I think our biggest finding was that the importance of feeling medically supported, and only 30% of our participants in the study said they felt medically supported during COVID, and that had a relationship with so many other aspects of their mental health and well-being, things like their optimism, their self-esteem, their confidence, and that feeling of abandonment that many felt, that they just couldn't get in contact with their rheumatology teams, with GPs. They couldn't get the help they needed in an emergency. But again, there was that disparity that some people could. Some people had excellent care. Some rheumatology departments still maintained that contact, even despite very difficult situations for them. So what we really want is that equality and consistency of care for everybody to be kept up, even in a medical crisis like COVID.
We've heard lots about, say, cancer treatment not coming online, and that is clearly awful. People can't get operations for cancer and can't get seen for diagnosis and so on. But do you feel like lupus is a bit of the forgotten problem? You're not getting the profile that cancer, for example, is.
Yes, very much so, and I think that's historically, as well as just during the pandemic, it's very it's an invisible disease. It's society don't really if you say you've got cancer, everybody understands. If you say you've got lupus, even doctors don't often understand that. So it's that equality of care. It's more support, it's more resources, it's more funding, it's more understanding, it's more training in medical schools, so that there is that equality and understanding that other diseases have, and including these patients in support, certainly for something like long COVID clinics, where these patients with lupus have suffered exactly the same fatigue, cognitive difficulties, joint pains for many, many years with no support. And now there's a lot of support and funding. So it's just being aware that actually there's this whole group of patients who would also very much benefit from a similar type of support.
Explain to people what it is like, because you have lupus. If you can't get help, how dangerous could that be?
It can be very dangerous. Obviously, there's a spectrum of severity, and some people will have a milder version, but still very life-changing. Some people will have life-threatening, and some people will die from it. And because it's a relapsing, remitting disease, you need help when you need help. So people have found on our study that they're ringing up their GPs, and the receptionist may say, "Oh, you can see a doctor in 2 weeks." Or the rheumatologist will say, "Sorry, I'm busy, I'll see you in 6 months." For somebody you can get very ill very quickly, that obviously doesn't work. So it's that immediate accessibility. I'm very fortunate. All my doctors very quickly contact me back, and I've got to know my own disease process, and very, very good clinical judgment of when I need to go to hospital and when it's reaching a severe stage. But again, so many people don't have that. It's finding the right doctors, getting the right specialists, even GPs who don't know that much about the disease. If they're there for you and they react quickly, that's a key point. Being accessible, being available, listening to the patients and getting to know them.